Hello and welcome to the Texas Mind Exchange podcast. My name is Cody Gould and I'll be your host. Today we were joined by Dr. Melinda Villagran of the Translational Health Research Center on Texas State's campus. We talked about what the Translational Health Research Center does, how it serves the community, and what the future has in store for research at THRC. So without further ado, welcome to the Texas Mind Exchange. Just as a reminder, all statements expressed by our guests on this podcast are their own and should not be considered official views or opinions of myself or anyone else at Texas State University. Melinda, thank you so much for coming to the podcast in which THRC, we run, and this is kind of the last podcast in this limited series that we have. And there was no better person than the executive director of the Translational Health Research Center, the center that hosts this wonderful podcast, to be on with us and share with us about what THRC is, how our goal of assisting mental health in the region is evolving, and just what the future looks like. So I guess with that said, I'm sure many people they know of Translational Health Research Center, they know of THRC. They might not know what we do and where we came from. So to hear a little bit of an origin story of our center would be amazing. Sure. And we can start from there.
Sure. Well, first, thanks for having me. I have been keeping up with the podcast and really impressed with everybody that's been on here. So I do feel a little pressure, I'm not going to lie, bringing up the rear.
You're doing amazing.
I think that you've had some really, really impactful guests that have shared things that I didn't know, which is really always when you take time to listen to a podcast, that's always, you walk away with something new. You go, okay, that was time well spent. So congratulations to you too for kicking off this podcast for THRC.
Thanks.
So in a galaxy far, far away, a long time ago, I was a professor at Texas State. I had achieved a lot of the things that I hoped to achieve in my career. And I was in a position that was really, really fun, but not a great fit for me because in my heart, I love research. And the reason why I love research is because it allows you to sort of do new things, but more importantly, instead of just focusing on problems and problems and problems, you could just focus your day on solutions. And then you can actually put them into action when you have partners. And so Translational Health Research Center is a huge name. I know, it's clunky. I don't even know what I was thinking when I came up with that one, but it is a term that's used in healthcare for saying research has to go from bench, like bench science, to clinics, to the community. It has to be translated, just like language. We have to translate knowledge to make it useful for people. And so that's where it comes from, Translational Health Research Center. We started out as an initiative. I'm a big systems thinker, and I looked at the system at Texas State when we were growing our research, and I realized that we had health in every single college, health research in the College of Science, applied arts, liberal arts, even fine arts and communication. There were really good researchers doing valuable things across the university, but they were incredibly disconnected. Because it's uphill in both directions. Nobody wants to lose their parking spot. And we don't always have the time to really talk to each other about what we're doing. Everyone's busy teaching classes, working with students, doing research, serving the community. And we didn't have a really good way to connect. And so Translational Health Research Center was an initiative initially that sought to kind of understand and catalyze the research that was already happening here with our faculty and our students, and do it in a way that made Texas State different from other universities in our approach to research. Because, we need scientific discovery, and that still exists here. But I would say the bulk of our work here is applied. It's applied research with a goal of finding solutions to problems and then doing research to make those solutions actionable. So we translate research to reality, basically. And in reality, it takes a minute, but it also takes partners, and it takes the community to work with us, because faculty, and I can say this because I am one, we're very educated about our field of study, but we don't always know what's going on because we're in the classroom. We're working with students. And so when you're talking about health or healthcare or mental health care, it's dynamic and changing. And so being able to ask the right questions with our research requires us to talk to experts that know what's going on on a day-to-day, month-to-month basis. You know, every year there's new things happening in our communities. We have a fentanyl crisis, or we have new apps that need to be designed and tested, or we have new opportunities to set up facilities in places where there is the greatest need that's unmet. But understanding all that is really hard, and it takes a lot of time. And so working with people in the field allows us to ask the right questions and do research that we can then translate through Translational Health Research Center.
Got it. When we've started as THRC, we've really understood the definition of health can be quite vast. It can be health, mental health. It can be soil health. It can be business health, things along those lines. Well, is the initial ask of THRC to assemble an Avengers team of researchers to help the community, or to look at the community first and then assemble a team that can then adapt to their needs? Does that make sense?
Of course, yeah. So I'm a systems thinker, and I saw at Texas State, in addition to having health research at every college, we also had a very strong focus on safety. So we have the Texas School Safety Center, and we have the Alert Center where they train law enforcement. So when you think of health and safety, we were pretty heavy on the safety. And we also had a really strong group of health researchers, but they weren't connected to each other. And so I started out by kind of filling this gap where health and safety intersect. But then you realize, so much of health research is, people think health happens in a hospital. That's where you go when you're not healthy, right? So health happens in our houses, in our communities, in our schools, in our lives. And it is impossible to think about mental health or physical health as being separate from each other, first of all, and separate from the places and the communities and the homes and the relationships where it occurs. Does that make sense? So for me, I kind of moved toward this idea of healthy and resilient people and places. Place is a massive indicator of health, because things like opportunity, access to healthy food, exercise, walkability. We did this big study with City of Austin years ago about commuting. People that commute more than 60 minutes to and from downtown Austin are less healthy, more likely to eat fast food, more depressed, more stressed out. They spend less time with their kids. They're more likely to have interpersonal problems. This is all self-report data. But when they commute a long way, they were not mentally or physically at their best. So place, that's just one example. Place matters. There's a ton of research they call the social determinants of health. But what it really is a lot of the things in your environment and the place where you live. We know that, environmental health, toxins, access to clean water, just everything around us impacts our health. And so if we're going to move out of hospitals and look at health, how it happens in the world, we have to consider place. And that is sort of a big marker of why we look to partner with communities and to understand the real issues in communities, because it's just kind of short-sighted, in my opinion, to think about, health as being simply biological or simply environmental. It isn't. It can't be. Because we're one person and we go a lot of places. We have genetics, we have environmental issues, we have social issues, and all of the pressures and opportunities in our lives. Those all come together in the way that we experience health. And then you add communication, the messages that we receive about what it means to be healthy. Those happen not only in our relationships, but in our communities, because, advertising and just the day-to-day water cooler, the comments that you get about the things that you do, and the way that you feel comfortable sharing if you have a mental health challenge, or not, and the cultural implications of that, right?
Totally.
So it is, to me, the best way to understand and improve mental health, thinking about it as a system that involves people and places.
Yeah. And that's, okay, this is good. That system, I think, has been really impactful for our center. And I'm thinking towards the I-35 Health Merge grant.
Yes.
Which I'm sure the viewers have no idea what we're talking about.
Okay, yeah.
But I would love your perspective on that grant, because it's kind of actually partially what we're working on now, which is connecting this corridor that is Travis County and Bexar County, which is a huge metroplex of people sleeping in one county, going to another city or what have you. And it's so parsed out on a map and in service. But in reality, it is so interwoven and interconnected that we should really start viewing this metroplex of Austin, San Antonio as a greater connector than I think we're actually viewing it as. Is that right?
Yeah. I mean, I think it's a human tendency to try to isolate things so that we can control them, and to think about things in bite-sized pieces because it's just more comfortable. But coordinating things and connecting them together gives us a more true picture of what's really happening. So you think about COVID. I live 20 minutes from my office. And during COVID, Texas State was still partially open for a lot of the time. So I was coming to work. So that meant that I was living and working in 2 different counties where the spread of COVID was being tracked. Because 20 minutes from here is Como County, where I live. And so if I had COVID, just for example, I could be counted theoretically as a threat in 2 different counties that were collecting 2 different data sets. And then when you layer on that, the federal government collects data by what they call metro service areas, or MSAs. Como County is in the San Antonio metro service area. And San Marcos is in the Austin Round Rock metro service area. So if you wake up every day and look at your dashboard for COVID to see what's going on, I could be impacting 2 completely different dashboards, 2 completely different data sets, and 2 completely different metro service areas because I live and work in 2 different places. But I don't think I'm all that special. I think there's a lot of people in Central Texas that travel up and down the I-35 corridor. So when you're talking especially about infectious disease, it's pretty clear why we have to think bigger than just our hometown, right? Because in some of the more rural places, like in Bastrop County and Caldwell County, there is not a lot of healthcare available. So they go to the doctor in San Marcos or Wimberley or Austin, right? And that means that the way that they access healthcare is different than where they live. So if we only measure people by their location, their zip code, where they sleep at night, we're missing part of the picture. And so that was happening, and I was watching it during COVID especially. So I wrote this grant that said, basically, Central Texas is becoming a metroplex, like Dallas and Fort Worth. I'm from Dallas, and so I understand that, Dallas and Fort Worth are very, very different, but they're also very interconnected. And Austin and San Antonio used to be completely different, but now there's Buda and Kyle and New Braunfels and Schertz. They're not 2 separate things anymore. It's one interconnected corridor in Central Texas. And people in Central Texas live and work everywhere. So the idea that we need to understand health as it happens means that we have to connect the dots and the data and the research to do a better job of looking how people really live. Because, for example, if you want to, avoid the spread of COVID, you're going to do a pretty bad job if you're really just saying, well, what's your address? What's your zip code? Knowing full well that you're driving around to 3 different zip codes and 2 different MSAs and 5 different cities where there should be some accounting of what's going on.
Yeah.
And so it's really clear to me that Central Texas is one big metroplex. And we have to start moving in that direction to have data, to have healthcare, to have opportunity to share resources in ways that reflect being one big metro service area. And that's not happening. It's better. It's better now. But when we started the Central State, the grant, and now the hub, the online hub, the goal was pretty simple. We need to connect the dots between San Antonio and Austin, look at Central Texas as one thing where people live and work, and they have mental health care and physical health care and schools and roads that are very interconnected. And so the Central State focuses on, it's play on words, again, not the best wordsmith. Started with Translational Health Research Center. The Central State is a concept that says our Central State as human beings is a state of interconnectedness. And here in Central Texas, the Central State requires people to have all the information, all the data, all the resources, no matter if they live in Buda or Schertz. Those are not 2 separate things anymore. And so we have to have a place where people can get reliable information. They can get data. Nonprofits can get, information that they need to get funding, to write grants, to solve problems in ways that are real. Because we can create solutions that ultimately just look for a problem. Or we can look at real problems by understanding them through research and then solving them collectively together. So Central State is an idea that says we're interconnected in Central Texas. We have to think that way. But it's also a resource for information and services for people that are interconnected, who live and work up and down this corridor.
The idea that data is so important, and I see this when I interact with a lot of the community organizations that I reach out to or network with or have on. Data is so important for so many of these organizations. And what I have found is that a lot of them don't implement data potentially as much as they should because it's hard to find, or they might not be trained on it, or data might not align with what they've done in the past, and that's what they know how to serve the community. We started doing the visualizing mental health training to help with that, basically to help with implementing data into mental health organizations to show where potential decisions could be made through using actual evidence compared to, well, this is the way we've done it and this is the way we'll continue to do it. Do you find that mindset really, came from the Central State and seeing how data can really change the trajectory of a lot of initiatives that are moving forward, and that's how we want to give back to the community by teaching other organizations how to use said data? Is that?
No, not really.
Okay.
So before I came to Texas State, I worked in DC at a university where I had a lot of graduate students. And in fact, I started a doctoral program that was around strategic health communication because I had spokespeople for FEMA and DOD and the VA who were my students and worked with me in my graduate program. And, they can't get up in front of an audience at a press conference and just start making stuff up. They start with data. Because if you're going to understand a problem, you have to have data. The word data, no one likes math. Well, some people do, but, a lot of people don't. And they equate data with math. I get that. That's no fun. But data is the best way to know what you know. As human beings, I think we always think we know. But the best that we can do is know what's going on today. We just don't have the ability to forecast the future. But with data, you do. You have a much better shot at getting it right, not for just today, but for tomorrow. And if you're trying to treat someone who has a mental health condition, the goal is not to make them well while you're talking to them. It's to leave them better in the days and weeks to come, right? So understanding what is the best thing is something that I think that's really linked to data. Because to be able to communicate with other people or interact with other people, you're limited to what you can see and feel. And that's not enough information, especially because health is so multifaceted. The reasons why people suffer from mental health conditions can be biological. They can be chemical. They can be relational. They can be situational, or they can be long-term. But if you don't ask the right questions, and asking questions and getting information, I consider information data. Numbers are just, they're markers for answers. They're answers, just like when you ask a question. So whether it's numbers or whether it's words, data helps you make better decisions because you can put several different things together to really understand something in a way that you can't just do on your own. So in my field, health communication, we start with data all the time because we want to craft messages that we think have the best chance of affecting people the way that we intend and not the way we don't intend. So we have to know a lot about a lot of things, about the people, the situation, the context, how different words hit, how they're interpreted by the receiver. And all of that together is how we craft those kinds of messages to stand up at a press conference and talk about something if you're, the spokesperson for FEMA. My husband was a spokesperson at the Pentagon in working at the press desk for the Air Force. And if he just, answered what he thought and felt that day, himself, I think he would have gotten fired. So the idea that we can know and that we can make decisions that are really all-encompassing and the best decisions, not just for ourselves, but for the other person. Without data, to me, that's just, I don't have that capacity, and I've never really met someone who does.
Yeah.
So it just makes sense. But the trick is, data is like clunky, and you look at it and you go, that's not relevant, and you don't have time, and you think because you've seen 17 clients that have the same similar thing, but you'll never know that this particular one goes to a school where they have a very high suicide rate unless you see the data. You might never know that this person lives in a zip code or a census tract where they have to take 2 buses to get fresh food. You might never know certain things that are unique about that person because if they don't share them, how will you factor that in when you're working with them? So they might seem like 6 or 7 other clients that you've had before, but they might not be. So using that data helps you do a better job of really pinpointing the issues that are going to be most impactful for an individual. And in my opinion, the clunkiness of data and the difficulty of finding the right data in the right moment that's trustworthy, it's too much to ask of somebody that's busy, that's working. So what we try to do through the Central State is provide that data so that it's easily accessible, the information, the resources, and the support that people need to get data when they want to use it to make decisions. If you went to the doctor, they didn't do any tests on you. They didn't take any blood. They didn't check your blood pressure. They didn't do anything. And the doctor comes in and diagnoses you. What would you think of that diagnosis?
Probably wouldn't trust it too much.
You'd say, oh, that's great. Thanks for nothing. See ya, right? I see everything that way. You have to ask questions first. You have to gather information, AKA data, that word that people don't like, but And then you can sometimes say, this data is not relevant, or it is. But what we want to do at THRC is make that data easily accessible so that people have the option to make data-informed decisions when it's appropriate, when they need it, just so they can feel like they're doing the best job possible for their clients, for their business, for their community.
Well, it sounds also like the word holistic kept coming to my to the front of my brain when you were talking about that, because how are we supposed to serve a community if we don't understand what is happening within that community? AKA, for example, the area that I live in Austin, I luckily have an HEB by. But if you go up about 5 minutes to one of my friend's house, it's a complete food desert. There's no gas station, things along those lines, restaurants, but those restaurants are kind of expensive. And the closest grocery store is really far away, probably like a 15-minute drive in the center of Austin. It's kind of a weird little situation.
Yeah.
Now, if you are struggling financially and you live in that area, it could be that you have to take 2 or 3 buses to get to a grocery store. And if you're seeing a client within that region and you don't know about this situation, or maybe they might have not, it's so ingrained in their everyday, that's just what they do. They didn't think to bring it up. Well, you're totally right. Like, how I can serve you better if I know that information. And I know that other people who are around that area are also struggling with that same issue. But if I don't have that data to be able to understand that issue, then I'm just going to start thinking that everything's fine and okay. Just as if I were to go into the doctor's office and the doctor's like, "You good?" And I'm like, yeah. And that's the end of it. But you don't know if it's an issue unless it is an issue. But the way that you find if it is an issue, it's a tongue twister, is if the data suggests that it is one.
Yeah.
Got
You
it.
can think you're the best clinician in the world, and you might be, but you don't know all of the information or all of the factors that should impact the way that you work with a client, right? And if I could just wrap it up into simple assumptions. Assumptions are dangerous. Even in Central Texas, there are a lot of people that do not have access to the internet. So don't tell them, "Oh, you can look this up later." Or recommend a mobile app that if they don't have cell service, they have to have Wi-Fi to use. Or recommend, a healthy diet when they don't have access to healthy food. Or, wonder, why is this particular person extra stressed out when you don't realize that they go to the most unsafe high school in all of Central Texas, where they feel very stressed all the time. Of course, they're going to be unique in some way, but finding that is just one piece of working with somebody. So your expertise really matters, but your expertise can be even better. It can be sharpened by the right information and the right context to be able to talk to someone and interact with them or prescribe medication for them in a way that they're going to be able to access, use, and stick with, if necessary, realistically. Because it doesn't matter if you give them, the best advice, the best diagnosis, the best treatment. If it doesn't fit their life because it involves cell service, the internet, transportation, relationships, or social support that they don't have, it's really not the best care that they should be getting.
Exactly.
Does that make sense?
100%. Absolutely does. I would love to transition us a little bit to talking about something else that the viewers might not know, but our faculty fellow program.
Yeah.
I think it's such an amazing part of what we do. And maybe people don't know exactly kind of what it is. So I would love to hear from you what exactly is our faculty fellow program, and how does that impact our community in any way?
Sure. So one of the really important parts of THRC as a center is what I have borrowed from a former colleague and friend, the front porch. The front porch, where people can access Texas State expertise and resources, facilities, and all of the things that we have to offer. I thought this was on. Sorry. Okay. THRC is a front porch to Texas State because in all the years that I've worked here and worked in the community and served in various different ways, I know that it's hard to figure out where do you start when you want to work with a faculty member. How do you find the right faculty member who has the time and experience and desire to collaborate? That's something that is daunting to all of us, even within Texas State. But think about doing it as an outsider. It's just not going to happen. And so this problem has existed for a long time. And when we have faculty that are really busy teaching, they don't always get out in the community either. So a disconnect was happening that was, unfortunate for us to be able to really have an impact from our work. So the Faculty Fellows Program is a front porch for community members, businesses, and others who want to partner with Texas State to be able to find the best faculty members. And they might not all be in the same department or discipline too. So, we work with engineers to find engineering solutions to health issues, scientists, of course, social scientists, people that do all kinds of research that you might not be able to put together yourself from the outside, but that we are able through our Faculty Fellows Program to bring together based on the project itself or the need, with the community member being a real true partner in that collaboration. So as the front porch of research partnerships at Texas State, THRC has a staff like you and others that are really invested in building relationships with the community. Mm-hmm. I am really, really, really fortunate that I have the opportunity to work with such really skilled people in our center who care about not only the importance of data and research and care about faculty and students, and the universities run to R1. All of those are really important. But the fuel that's going to probably make that a lot easier and a lot better for us all is if we engage the community, businesses, nonprofits, local governments, schools. We have to do that. So we have to make it easy. Mm-hmm. So the Faculty Fellows Program is, quite simply, an entry point for community members who want to work with us. And we do the legwork. And our staff has the expertise and the knowledge to go, oh, you need so-and-so from over in applied arts, and so-and-so from nutrition would be really good for this project because. And, oh, if you're talking about designing something that's, a new technology that you want to try in your clinic, I can call so-and-so in computer science and so-and-so in engineering because they have exactly the expertise that you need. And they have really, really amazing students that they can bring into the project too. So we do the legwork to build the relationships and make the connections between things that are happening here and things that are happening in the world. And so we're a little bit like, the matchmaker or the Bumble of research. But we help people find each other that need to work together to solve a problem that they share.
It almost feels like an incubator of sorts. Is that the right word? 'Cause that word was coming to mind, where someone comes to us with an idea and they're like, I don't know who I want on this or what exactly it is. Say somebody from the community is like, I have this amazing idea for this new mental health software. And we're like, okay, we definitely have people that can help, whether that be Ty Shepis or, Dr. Cleary or whoever.
Sure.
People we can kind of begin to fold in, or the people from engineering or things along those lines. And it almost feels as though an incubator was what came to mind, was because we are able to take that idea and take that community member and kind of bring them into the fold of Texas State and of all the amazing faculty that we have here, and be able to kind of hopefully produce something for them that the community can then run with.
Yeah, I think when I think of incubator, I think of a vessel that holds and so I think there's a certain amount of ownership around that thing that you're growing. And we are in some ways an incubator that we help people develop projects, but we're more like glue.
Okay.
We're glue in that really talented and innovative and motivated people come together who didn't know each other and didn't know they needed each other. But that only happens because we have, I'm old, so I can use the word Rolodex. We have the best Rolodex. We have taken the time to make the relationships, to identify not only who could do it, but who should do it, to make it amazing. And so when somebody comes with an amazing idea for new software or new whatever, they want to have a new clinical, outreach program, or they want to reach a new population or whatever. I don't always have the answers to that, but our Faculty Fellows program allows me to say, I can put you in touch with, and not only put you in touch with, but help facilitate everything, the wraparound services that will be required to make that happen. Because you're busy doing your thing. Researchers are teachers too, and they're busy doing their thing. And you both have this sliver of time that you could devote to this project if we take all the legwork off your plate. So that's what we do at THRC. We make the relationships happen. We make the introductions happen. We find the best people that have the capacity and the heart to do this work. And then we provide the wraparound services to make it possible.
And does the same go for grant funding and grants that come from, that we might be interested or that we're looking for partners with? Because the reason I'm asking this is some organizations have reached out to us and said, we would love to partner with you on said grant, or there's a couple of grants coming down the pipeline of something that we would like to partner with you on. What does that look like? Because I know we've had some of those conversations, but I think for the public to understand how we work with organizations from a grant perspective would be pretty interesting.
Yeah. Well, my whole life I've had a slight problem with no. And when you aren't someone that really loves to be told no, the best way to manage that is sort of twofold. One is to ask, okay, but what's possible? I'm a very what's possible person. And when people come with great ideas, I don't want to say, no, we don't have the resources for that. I want to say what's possible. And then I get really excited. And the second thing is then I go, okay, how can we fund it? So I'm a little bit of an academic entrepreneur myself. Mm-hmm. I like to think about yes, but yes usually requires resources, AKA funds. And so early in my career, I realized if I was going to get to do the things that I wanted to do, the way I wanted to do them, I was going to need to fund it myself through grants. And so I find it really empowering, honestly. And our entire center is funded through proposals that I and others have written to get funds for what we do. We were not given a giant pot of money from anybody without building a case for why it's important. So writing grants and getting grants is incredibly empowering because you can do pretty much whatever you want as long as others see value in it too. And I know that it took me a long time to learn that. I worked at multiple universities, at UT Health San Antonio, and I started at the very basic level of grants and worked my way up to where I've had many $1 million worth of grants as a principal investigator and lead. So I'm really willing to share that expertise with other people, and that can look two different ways. One way is that we can lead. As an institution, we have Office of Research that can manage the relationships and the reporting and all of the things that are required when you get a grant. And then that money can be shared with the people that we collaborate with in the project from Texas State, from THRC. The other way that we really can work with people to get funding to do things that are going to have an impact on health and resilience is when an organization wants to do something, they want to get a grant, but maybe they don't quite know how to do that. And they might need, for example, communication services related. They don't really have the capacity to hire a full-time comm person, or they need somebody that's going to be an evaluator to kind of evaluate the program and provide the data back to the funder. Well, we can plug in the specific pieces that the lead needs. They're still the lead, but we provide the extra services that would be really hard to go find on your own. So those wraparound services can either be with us leading and then providing funding to a partner once we get a grant, or it can be the community member can get a grant, but they just need specific services to deliver that grant that we can help take off their plate. And then we just do kind of a relationship that way. But what we're trying to do is help people be effective in getting funding to do the things they want to do that can improve health. And that's a big, tall order. You know, I've been in this business a long time, and it took me many, many years to understand the basics of that. And I'm not always successful. I write plenty of unsuccessful grants. That's just part of the deal. But having the ability to write something that really demonstrates a need that you're hoping to address, to solve, that also aligns with whoever's providing the money, the funder, their priorities, that really takes some practice. And then when you get a grant, making sure that you are a good steward of that money and that you document things and that you do things the way you said you were going to do them, very important. And so doing that on your own while also maintaining whatever you did before you got the grant, it's tough. Yeah. And I realize that. So a big goal for THRC is to be involved in grants, either as the lead, which we have many, many grants that we lead, but we also don't have to lead. We can follow and we can partner to just fill in the gaps that make a grant possible for some other organization that has a better chance to lead the thing that we're trying to achieve.
Yeah. Well, I think it's really important that you laid out both of those sides, because I feel as though with the changing tides of funding and things along those lines, there is extra pressure that is put on, especially a nonprofit, to continue to do what they're doing and go for more.
Yeah.
And with that being said, we, as somebody who can, or as an organization within our center, to plug in and be able to take something off that plate so that they can do better at whatever money they might have, it's really an important part of the process that kind of gets forgotten.
Yeah, we just want to meet them where they are. We're not expecting everybody to have all the answers, because we don't, but we have some expertise and we have some capabilities and systems in place and experience that can really amplify the good things that the partner brings to the deal, the things that they want to do based on what they know is happening, or their access to a population or their location or whatever, that we don't have. So we find those kind of, mutually beneficial partnerships that make sense. And then we plug in ways that make sense. Because the goal is not to take anything over. The goal is to achieve the outcome that we're all seeking.
Yeah. Over the years, we've had a lot of different focuses. Again, we've talked to, even just myself, I've done a lot of mental health stuff, but I've also done a little bit of business health things. I did fire health and for firefighters for a little while. And all these amazing initiatives that we've worked on have really created a holistic view of how we serve the community.
Yeah.
With that said, what are you most excited about in regards to where THRC is headed, or initiatives that we are starting to kind of get involved with that are interesting and potentially really impactful?
That's a good question. So we're a state university, and I try to be very responsive to things that I hear in our state, from the legislature and others about the needs that we have, so that I can be a good steward of the opportunities that I've been given and find funding to have an impact in those areas. And so you're right, we have done lots of things, and we do have this broad, holistic approach. Some people might say it's, we pursue opportunity, we're opportunists, but I would say we are evolving. I said we're about to start our 5th year. And we've been in this kind of evolution to find our stride, and I think we've found it. And the answer is that we're going to continue to do things that we've always done, but we're going to, like what you just said, we're going to add other things too. And just because you don't hear your magic words in our description of ourselves, it doesn't mean we don't do it. It means that we don't do it right now. But if you have an idea or you have an opportunity, that could be added to our portfolio. So moving forward this year, we kind of have 5 key areas, Peg, that we are looking to kind of continue our work in the mental health space, but shift it slightly. So, for example, veterans are very important to me. My husband was in the Air Force for 24 years, and veteran suicide rates are still way higher than they should be. I'll say it that way. So we have some really great faculty experts and fellows who work in veteran health. So we're going to be working on that. Now, that does not include mental health, but in the name. But obviously, it's completely linked, right? So just because you don't hear mental health, veterans have a lot of mental health issues. So one of our focus areas moving forward this year, veteran health, suicide. Obviously, we have great faculty experts and fellows in our center that have been working on suicide indirectly, but we're going to have a real strategic focus on trying to address suicide. So veteran health and suicide. Then the state of Texas has put forth an initiative around dementia and Alzheimer's. Again, not directly mental health, but obviously brain health and issues that impact dementia, like loneliness. I don't know if you know, loneliness is one of the biggest predictors of escalation of dementia. Because if you don't talk to people and interact, social relationships are a critical component of health, just like water. If you don't have them, you start to withdraw. So loneliness, for example, is a really big predictor of escalation of dementia. And so we're looking at dementia and Alzheimer's, but that certainly includes aspects of mental health and brain health, and our mind and body connection is inherent in that as well. So veteran health and suicide, dementia, Alzheimer's, and then we're kind of in a growing partnership with a university in the Texas State University system, Sam Houston State University, that is in Conroe. Huntsville is the main campus, but they have a new medical campus in Conroe. And we're working with them a lot to think about how we can kind of make a triangle with our Round Rock campus, where there's a lot of our health professions, our San Marcos campus, and Conroe, to do things together so that where, an organization might want to have kind of a bigger footprint for some kind of intervention or some kind of program, how we can do that together. And those partnerships can help us amplify things from one clinic, one community to a big piece of Texas and do it in different communities in different ways where it makes sense.
That is, I think, really interesting to hear from my perspective, simply because all of these things, to some capacity, as you mentioned, are mental health focused. But we don't need to say it's mental health. We can say we are serving veterans. We are serving people who unfortunately suffering from suicide ideation or things along those lines. We're serving those with dementia and Alzheimer's issues. Who don't have dementia, but dementia is a lifelong thing. It starts and it develops over time. So not just people that have dementia, but people who are at risk of dementia down the line. Well, okay, this thing about loneliness is really interesting, and I'm going to take a little bit of a left turn, but I think it's going to be fun. I wonder what the future will look like for dementia as we progress with understanding the future of especially young male loneliness, which seems to be a really interesting topic that everyone seems to be talking about right now. And because of like early onset Alzheimer's and things along those lines, like granted, I am totally going off left field here, but I'm wondering what that might relate, because obviously dementia, mental health, loneliness starting earlier and earlier in life, separation from people of interpersonal interactions, and mostly having mediated interactions online, virtual, things along those lines. I wonder just about how all those things are potentially interconnected, and what the, I guess, downstream effects are of things that we're seeing currently right now. later in life? Is it earlier onset dementia? Is it things along issues with Alzheimer's or other mental health issues, or potential suicide issues, or things along those lines? So that was just one thing that popped in my head, specifically just about the word loneliness. That can go so many different ways, and we can look into that issue from so many different lenses.
Yeah. It's a perfect example of why we need research. So as a mom, during COVID, going into COVID, I had 2 kids that were going into high school, and they were both supercharged, involved in everything, at school all the time, sports, academics, After COVID, my daughter explained it. I mean, she, was a freshman at Vanderbilt University, and all the kids there are, they do everything. And she said, Mom, it's like we're all, sitting around on the couch after Thanksgiving dinner. None of us just really want to get up and do anything anymore. That was the post-COVID malaise. And then I have a son who I routinely get in discussions, I'll call them discussions, with about whether loneliness means sitting in your room on your computer. And I interact with people all the time. I don't know why you think I'm lonely. I don't know what's wrong with my social relationships, because, just because I do it on video games doesn't mean I don't do it, Mom. So maybe I'm wrong, or maybe he's wrong. But I don't think that the evidence is super clear on this right now. It might be more clear for him as a person at his age, but it's definitely not clear in terms of the long-term, lifelong changes in his brain, in his network, in his ability to have social relationships, in his anxiety. I think there's an increase in social anxiety when people are more isolated that then changes the way that they interact, and loneliness could be a byproduct of that. I don't know. These are all things that are way outside of my area of expertise, but you're exactly right. The changing nature of technology in our lives, it creates the need to have ongoing research and data to understand the relationships among things. But, AI also creates an opportunity for us to catch it before it's a problem, because we can start to put together certain predictors and even address it just in sports. You have to go to Sports Physical. I think that's a great place where certain things could be collected or caught or connected to help identify potential problems before they happen. You go to your regular annual checkup, and it's sort of like the same old, right? But what if we could use that as a way to really kind of look for some known predictors to help us identify people that are really at risk and those who aren't? Because I don't think everybody that sits in their room and plays video games is the same. So we can't treat them as though they are. And I can argue with my son that he needs to go and, get some sunshine. But if he just goes on a run by himself, I don't know if that's meeting the loneliness thing that I was seeking to address, It's all very complex and very individual. And the more we know about how technology impacts us, not in the moment we're using it only, but also across the lifespan, critical. And the more that we can use technology to our benefit to get in front of problems before they occur. That's what I think.
I think that's great. I think you also made me just think of, we recently spoke with Andy Miller from Austin Child Guidance Center. He was amazing. He mentioned that due to the research that he was exposed to, I forget exactly where he said it was from, but he said that children who have trauma or adverse childhood experiences in the first 3 years of their life have a higher potential to incur mental illness later in life. Yeah. And so what they've done is they've started placing licensed professionals into daycares underneath Austin Child Guidance Center. So they're Austin Child Guidance Center therapists. They send them to a daycare that specifically serves that specific demographic of person, so 0 to 3, and potentially that might have had some traumatic upbringing, and to have early intervention as soon as they can. And so that child can get used to dealing with the therapist and kind of digging into some of those things that they can, at least at that age. to help with the downstream effects of what potentially is coming, like using research to do that and implement and help the community.
Perfect example. Why is it the first time that we do anything, we have an intervention, is after the adverse effects of a problem are in your medical chart? That is what everyone's afraid of now, especially, with the AI world we live in. I don't want it in my record. Okay, then let's come up with interventions to make that not happen. That's so great to be able to get in front of issues based on place, based on a variety of characteristics that aren't, 100% predictive, but they give you a really good sense of where you could do some good with an intervention that could potentially avoid problems. That is powerful, but we're just beginning to think that way. And that's kind of why, like the technology piece with mental health, especially, connecting the dots is really more possible than ever. And for a person that asks what's possible and loves to do research and get grants that approach these things in ways that make what's possible happen, this is a great time to be in my business.
Yeah. Do you think that the tides of reactive medicine are, we can say medicine in general, or the reactive focus to our world are slowly shifting to become more preventative? Like, I guess what I mean by that are grants funding more preventative measures?
No.
Okay.
Unfortunately, our pay system pays, it's sort of, I don't know what that movie was, Tom Cruise a long time ago, where, you can't have a criminal justice system for people that have not yet committed crimes. You can't have a healthcare system for people who are not yet in need of healthcare. And prevention is a very tricky thing because you can't really know exactly who's going to get cancer. You can take a big guess, right? And a big guess is really expensive, and it's not going to show direct outcomes in ways that I have cancer, I get radiation, I get better, right? So prevention is funded much less often, but our ability to predict with precision who needs the prevention services using AI, using technology is right on the horizon. And that's exactly what I was just talking about, is that up until now, prevention has not been funded at all, not even close to the rate that we fund research on disease and illness that's already happening with patients who already have it. That's going to change, I believe, with our ability to do a better job at pinpointing who's really going to get cancer. And I think we can do that by connecting all these indicators using things like AI in electronic health records, by eliminating this false dichotomy between mental health and physical health when we have one heart that pumps our blood through our body every time it beats. Like, it doesn't make sense. I get it. I think it happened because we needed to have experts that were taken serious, that had credentials, and those credentials were unique to a certain thing. But it's not how it happens in our lives, in our bodies, in our world. And so, again, this connection of data, information, resources, this is going to be a good first step to be able to get more funding for prevention research, because we'll be able to show funders return on investment. We'll be able to say, yes, we can do that, instead of, we'll put it out there, but we hope we hit the target. That's not a good use of money. I wouldn't fund that. Yeah. But we're going to be able to do that really soon, if not now, because we're doing better at connecting the dots using AI and other tools that are involving technology in the process.
Yeah.
So when you have a really important health issue that's happening in real time, like just take, for example, the recent floods. The first thing is people want to know what is happening. Why is it happening? Is it threatening to me? How long is it going to happen? Who's impacted? And all of these things require you to collect data to give real answers, because I could sit here and say, I think it happened because fill in the blank, and I could be just making it up, but that doesn't do anybody any good. So things like water and things like floods, they aren't just health either. That's where this whole connection piece happens. So I actually just did a project with some people from Meadows Center for Water and the Environment, which is also within Texas State, because we have a shared interest in the importance of water. Water is critical for health, but it's also critical for communities and community health and community sustainability. We need access to water, right? But not at the level of the flood that just happened. So what data does is it lets you look at things historically in a very quick snapshot to go, is this the biggest flood we've ever had? Is this normal? Is it typical for this many people to be impacted? How many dollars or how many resources are going to be required to address this? So they had to figure out, how many responders, how many, all of the personnel that was required to address it and to bring it, into a level that was more manageable and to do the very difficult and emotional, search and rescue effort that was needed in this case. That required data. It required them to understand what was going on so that they could do a better job of addressing it. So that's a very large scale example. But when I did the project with Meadows, we were looking at access to water is critical for communities. And there was a lake, Lake Dunlap, which is just south of San Marcos, that they decided to drain because they were going to fix the dam. And this had really big implications for people that fish in that lake and rely on those fish to eat, and business owners who rely on, having customers, and the ecosystem and the water upstream from the river that flows into that lake. And so Meadows was looking at it from kind of a water use perspective, but I was looking at it from a health perspective. And the student that we worked with on this project, he brought all that together to talk to all different people in the community, to look at the same issue in all these different ways so that we can understand when a water board decides to drain a lake to fix the dam, the only people in the room are the water use people typically, but the individuals and the community members that are impacted by that might not be there. They might not have a voice, but they get a voice through data and through research that allows them to have a seat at the table to say, okay, in the future, if you do this, and we now know better, and we can tell you, here's some other things to consider so that a decision can be made with the best possible evidence. So in either case, whether it be that flood or whether it be the example I gave about the water use in the lake, we need water, but we need it to be manageable and in the right quantities and not dangerous and drinkable. And we also need it for sustainability in our communities. And looking at that as just a health issue or as just an environmental issue, it leaves out part of the picture, And so we're able to bring together these coalitions and look at things in a more holistic way through partnerships with other entities within Texas State, within the community, and then get the resources for state and federal research that can give us more information to do better if there's a way we can improve next time one of these issues occurs.
Yeah. As we begin to close out, I'd love to kind of go back to what we talked a little bit about, which is the THRC lifespan over 5 years.
Yeah.
We've done a lot of different things. We talked about the majority of them. Do you have one specific thing that you're most proud of over the past 5 years?
I think the thing that I'm most proud of is that we serve people. I worked in government and I have a service heart, a service mentality. And I think as a public university, we should use our research to serve the public and the people that we study. We serve our faculty to help them do the research that they want to do, that they're expected to do. We serve our community to share information, to do things like this podcast that help people have new ways to think about things or, to meet people or to have opportunity. And that service component of what we do, I think it's pretty rare. Universities serve our students, but we don't always bake into our formula the need to truly serve through research. And THRC does that better than any organization that I've been a part of in my career across 4 different universities. And I'm really proud of the way that our staff, our faculty fellows, and our administration really value applied research that serves people in ways that really improve health, not just in ways that help us get grants and understand health.
Mm-hmm. Amazing. Thank you so much for joining us. What's the best way for people to reach out to us? I guess just through this podcast, through me, or
Right. So Translational Health Research Center is at Texas State. We have 2 locations. One is on campus in Nueces Hall. The other is in the medical building at the corner of Stagecoach and
Hunter Road.
Hunter Road. Yes, exactly. And we're all over the place as well, out in the community at events. And we have not only our own website, which is healthresearch@txstate.edu, but also the Central State website, which is the hub for all of the data and information and services that we've been talking about that spread across all of Central Texas. The other thing is that we have a large staff. We have people that work in communication, that work in community outreach, that work in research services, both on the development side and on the delivery side. So we're out and about. And I would say if somebody wanted to get a hold of us, they should be able to get somebody from our team who can connect them into a bigger network of people and opportunities and help if they need it.
Yes. Yeah. I think the easiest, most simple way to get a hold of us, I would suggest, is just looking up Translational Health Research Center, Texas State.
Okay. Well, that's
And
the easy way.
you'll
I had
find-
to
you'll
go
find
the
my picture.
long way around, because that's who I am, the long way around. Yeah, you're right.
Yeah.
THRC is our short form for Translational Health Research Center. The Central State is our short form for Community Partner Hub. And those 2 together, you can search on the internet and we will come right up. But on the Texas State website, we're Health Research, and that's our email as well.
Yes. Thank you so much, Melinda.
Thank you so much for having me. I really appreciate it.
You rocked.
Well, thanks.
This podcast was presented by thecentralstate.com. Thecentralstate.com is a consortium focused on improving resilience in Central Texas by using evidence from research to improve human and community health. This website highlights health and research data by county and opportunities to find funding and resources for mental health programs in our area. Additionally, there are interactive calendars that keep you up to speed regarding what is happening right here in Central Texas.